So I will demonstrate the treatment in a short while. Just want to make sure her creases match. The crease of her clothing matches her buttock crease. And so we finished treating her, and now you can see that there's a distinct symmetry. And more important than symmetry, of course, is mobility. I can now take up the slack. I can now spring that. If I come on the other side, I can take up the slack and spring it. I can spring it medially on the right sit bone, and I can spring it laterally on the left sit bone. The coccyx is much more symmetrical. I did not have to treat the coccyx directly. And I'll palpate the sacrotuberous ligament now. So again, this pattern is called a left lower windswept pelvis. And so here's sacrotuberous ligament, and I can now indent that. Okay? So this is an example of the stress tests that I use for evaluating mobility in the lower pelvis. And if I could, let's see, the way that I treated it was with the client lying on her stomach, I externally rotated the left hip and stretched that for 2 minutes. I internally rotated the hip on the right for 2 minutes. And now lie on your back. I stretched the left hip and pelvis into adduction for 2 minutes. And then I did distraction to the right hip, inferior glide, and then stretched her into the direction of abduction, which stretches the adductor muscle group. Okay? So I hope this is informative on lower pelvic stress tests and the value in diagnosis and in evaluating response to treatment. And it also describes the pattern I discovered, which is called left lower windswept pelvis.